YouTube family, I'm so glad this time I'm not talking about any clinical stuff. We are talking about our office. And as you know, for 20 over years, I'm the only doctor in the office, but I have good news for you. I actually have a new associate, Dr. Chuong, and she's going to help me to take care of the patient's family. And again, not that I'm leaving or anything, I just want to reassure every one of you I'm still here, and Dr. Chuong is actually my personal eye doctor. And she have great clinical skill, and she take good care of me. That's why I invite her on board, so that she'll able to use the same clinical knowledge and clinical skill to my patient's family. And I want to welcome her aboard, and also I'm going to let every one of you know her a little bit more. And so this week, and when I'm doing the YouTube video, I'm going to again ask her some questions so that she'll able to tell you more about herself and let you all familiarize with her. So don't be a stranger when you come in. Even you're going to see me, I still want you to meet Dr. Chuong, because again, she is not only a great clinician, also a very delightful person, and I would like to definitely say hi to her. And thank you for all these years of coming to us and being our family.
My family, I have two older sisters and my mom and my dad. We are from Malaysia. We moved over to the States when I was 4 years old. We actually moved to New Orleans first, and then a couple years afterwards we moved to Houston in the Katy area, and then since then we've been there. My parents are still out in Katy. But yeah, definitely really close with my family. I still talk to them a lot, video chat them. Definitely talk to them about my daily life and whenever I have any new decisions. That would probably be my parents. My parents, they grew up in a pretty small town back in Malaysia, but they worked really, really hard, and I think they shared that with my sisters and me. We grew up learning to work really hard for what we want, so I have a really strong work ethic, and then to just be grateful for everything that I have in my life. Since they grew up with not as much, but since they worked hard and got us to where we are now, definitely that is what me and my sisters are doing now with our lives, to work hard and just be thankful for the blessings that we have in our life. Growing up, I was always stronger in math and sciences, but I didn't really know what I wanted to do with my life. Going into college, I was visiting all the different orgs, and I checked out the Pre-Optometry Society. And compared to the other health professions, the optometry students were definitely a lot more supportive. And I liked having that in the community, because knowing that these are the people that are going to be in the community in the future, that was something that was really nice. So that was what made me interested in optometry. And then afterwards, going into clinical care, it was really interesting how the doctor was able to help patients out by sharing their knowledge. And I felt like having an impact on people was something that is a plus, and also a benefit of just being a doctor. Other professions, both my parents are engineers, so that was definitely something that I heard about. But applying into college, God was just like, no, let's not do engineering. And then he steered me towards optometry. So after that, everything just kind of cleared the way for optometry. In optometry, there's a lot of math and science that plays a part into it, knowing optics, how the rays and sunlight work. It made it a lot easier to understand the background of why glasses work, why contact lenses work. But I think another strength of mine is I do enjoy learning. And in optometry, it's a profession that is continually advancing, and there's a lot more technology, more subsets of optometry that's always growing. So I think that's something that that's a benefit to me, because if I enjoy learning, then I'm always up to date in how I'm taking care of my patients. I do really align with the values of this office, being very thorough in our exam, telling patients even if they don't have symptoms, if there is something that we find, being very thorough in our findings, I think that's something very important to keep our patients educated on what we find, and then giving them the option or giving them the decision in our treatment. I think that's very important so that they're up to date on what we see and we're not just ignoring or skipping measurements and stuff like that. So I think that's very important. I do like connecting with people. Every day there's a new person that comes in, and it's a diversity of people that come in that we see. I think that's very interesting. Every day isn't the same. It's very new. But I also like how optometry and just in healthcare in general, it takes the focus off of ourselves because we're serving other people. And I think that's very important so that we are very selfless and we're humble in just living out our day. I think that plays a part.